Then we have ETEC, enterotoxication E. coli. And we have EIEC, entero-invasive E. coli. There is a different category. It is very much complicated. So you just talk about E. coli. Okay? So just give you an example. Now, travel diarrhea could be caused by enteropathogenic E. coli, enterotoxication E. coli, and the enteroinvasive E. coli. Next one, Yersinia. Yersinia happens frequently in pig chitlings. It's not a big deal in the United States. You never eat pig chitlings. You can get a bowl of pig chitlings in Chinese restaurant in Pittsburgh. So they cut from the pig chitlings and they cook it. It tastes very good. The bad thing is there are lots of fat there, lots of fatty acids there. That's not good for health, but tastes good. That's a major reservoir for Yersinia. In the United States, for the industry, they don't eat pig chitlings. The pig chitlings, the only thing they make it as a casing. It's a casing for the hot dogs. So that's not a big problem. But just let you know, could be an issue if it's a pig chitlings if you eat it undercooked. Listeria mouse autogenous we will mention later on, related to ready-to-eat foods. Hot dogs, turkey breast, cause meningitis and still baby and miscarriage. And that bacteria can grow in the refrigerated temperature. Viral parahemolytic, it's maybe the shellfish, seafoods. Clostridium perfringens difficile, we already mentioned. Okay, so these are the things we just briefly go over. Okay, this guy. We talk a little bit about the dental health, and I just go over these slides right here. This is what happens for the dental hygiene. You have a decay, you have a plaque in your teeth, what is going to happen? First of all, there is a true reason cause dental problem. Number one is genetics, you cannot control. Number two is diets. If people eat rice, like me, we are from Asian countries, we eat rice. The major components, the energy resource of the rice is those sugar, like glucose, sucrose, fructose. And in your mouth area, you know has a paradigm streptococcus. Streptococcus mutans is one of them. They will stick on the surface. So let's say, give an example. Okay, this is the teeth. These are teeth, okay, I'll just give you an example. Now you have a bacterial growth. More or less have some. This is Streptococcus mutans. If you do not do a good teeth brushing, what is going to happen? They will grow there. They will grow there. The layer will be heavy, heavy, heavy. What is that called? Biofilm. Difficult to remove. And then you eat, let's say, rice. What are you going to have there? So dextrose, okay, glucose, sucrose, fructose, all kinds of disugar, single sugar will be there. In your teeth area, limited oxygen. Okay, again, limited oxygen. So what's going to happen? The very easy we will have is fermentation. Is that right? So these bacteria these sugar will go through fermentation. Fermentation will generate a gas, but major is acid. For example, lactic acid. Then these acids will attack it. What is the structure of your teeth? Animal. The acid attaching to the animal will cause de-animalization. Once the de-animalization happens, will cause tooth decay. So that is a story. okay, for the sucrose and the plaque formation. Chloryl, we mentioned, vibrochloryl, comma-shaped, gram-negative bacteria. Major problem is what? Dehydration. You lose tons of water from your body. They come from shellfish. How come they have a problem? This we want to explain to you a little bit more. We have slides for this. We want to talk to you a little bit more about that, to describe the chloryl. This is the thing you need to know. This is lumen. This is blood. Normally, you more or less have some sodium chloride, which is salt. These, I will not say it's all go outside or go inside. Okay? I will say it's a balance. Can you please not talk there? It's balanced. Know what happened? Once you have this chloryl toxin, it will cause one thing. Remember, you had AMP become ADP, and you become ATP. This is energy currency. And I will mention this later on. If this guy, circle, become a cyclic AMP, which means this guy becomes CAMP, the bad thing will happen. Including your mutants, a mucus on your respiratory tract, all those causes AMP becomes CAMP. Very easy to understand it. This is a reaction to generate energy currency. If anything circle, you cannot go this way. This is energy currency. Okay, if you don't have energy currency, what that means? You don't have money to use. All the money is locked in the bank or frozen it. These days we talk about the freezing budget. They're freezing it. Then they become CAMP. For bacteria, they don't have energy to use. Of course, they're going to be dead. And same thing for the human tissue and the human function. So the chloryl toxin will be activated. So-called cyclase. Once the cyclase has been activated, then AMP becomes CAMP. This is unbalanced, which means all the sodium going to go to the lumen area. So what happened? This is called osmotic unbalance. Once this happens, all the water going to be pouring from the bloodstream. What is the major components of our blood? It's water. So all the water going there, they cause diarrhea. Severe diarrhea, the water diarrhea, you could lose around 10 liters in about 3 to 6 hours. So once the people have chloryl, the first thing what you're going to do is oral rehydration. Accompanied use antibiotic therapy later on once you put your water back. Now, of course, it will happen is rice water stools. Okay, so this is the key thing we want to mention here, is this AMP becomes CAMP. Lots of the toxin could be activated cyclase. That's a very simple mechanism behind that. If you want to understand, no money to be used. It's like a budget frozen, freezing. Okay, so that's something I want to mention. We will talk about later on. When we go examination 3, talk something more detail. Okay, this is all we have for the slides, and this is examination 2, lecture 2. Don't forget, you're going to have to go home reading what I put in here about the after class reading. So I just show you some of the examples. Gram-positive cocktail. We mentioned it here, very detailed. Rebecca Lansfield group, alpha hemolytic bacteria. And I did a very good conclusion, I think, beta hemolytic. And don't forget, let's do some of the questions. Let's do a question, case study. An 80-year-old female, she's experiencing chest pain, chills, fever, shortness of breath, productive cough, gram stain, white blood cell with gram-positive diprococcal. What is the disease caused by this ammonia? You should tell me this in 10 seconds. Which paragraph? D, Streptococcus ammonia, is that right? Why? Gram-positive diprococcal. That's a typical symptom and a typical characteristics from Streptococcus ammonia. Very good. Let's look at the top. 2-year-old hospitalized, skin violet color, blisters. Look at here, that's the keywords. Gram stain, positive coccyl in chain. That's the keywords right there. That is the keywords right there. Which bacteria caused by this pathogen? Tell me. 15 seconds again. Streptococcus pyogenes. Yes, very good. First of all, gram-positive coccyl in chain, which means it's Streptococcus. So Staphylococcus is gone. And the Staphylococcus agalactiae, which is for newborn baby, ammonia, meningitis, is that right? Septicemia, bacteremia. Now you left only Streptococcus pyogenes. Okay, you can get the answer is E. But if you want no detail, go back to read. Here we talk about from the blisters. Okay, chicken pox blisters will cause Streptococcus pyogenes to get contamination. So just gonna give you some example. This you should study by yourself. And here I did a quick conclusion for everything. Epidermis, Staphylococcus pyogenes, and the Staphylococcus is right here. And also have a case study. You should read it, okay? This is something I want to mention. Also, I just postponed after class reading 2. This you should also read that. We already talked about the corynebacteria. Then the corynebacteria, this is a case study. And then when you go down, Klebsiella we briefly mentioned. Haemophilus influenza, chocolate ugly is used for isolation because it's a fastidious bacteria. And the case study. Okay, Bordetella pertussis. This is coming from different textbook and concluded. So you should read these. And I'll have after class reading 3, which is for Clostridium. And next Tuesday we'll talk about sexually transmitted disease, and we go ahead and talk about antibiotics. Okay, so that is the question. Very good.